Have you ever thought the flu was just an annoying cold you could ignore? Think again. What starts as a few days of fever and fatigue can spiral into life-threatening complications, especially if you're in a high-risk group. Let's uncover why the flu deserves your full attention. Most people chalk up the flu as nothing more than a bad cold, a short-term nuisance that you can simply power through until it passes. But the truth is, influenza is a serious respiratory infection that can quickly become much more dangerous than most realize, especially if it's left untreated. For many, it's a week of aches and exhaustion, but for others, especially the very young, the elderly, pregnant women, and those with chronic health conditions, the flu can mean hospitalization, long-term health consequences, or even loss of life. That's why recognizing the early signs and taking action is absolutely critical to prevent the situation from worsening. Let's break down the major complications that can arise from the flu and why you need to take it seriously. One of the most common and serious complications is pneumonia. When you have the flu, your immune system is busy fighting off the virus, leaving your body's defenses weakened. This creates the perfect opening for harmful bacteria to invade your lungs, leading to bacterial pneumonia. Imagine struggling with a relentless cough, sharp chest pain, labored breathing, and a fever that refuses to break. For some, especially older adults, viral pneumonia can also strike, making recovery even more difficult. Next, consider bronchitis. The flu can inflame your bronchial tubes, causing a lingering cough and persistent chest discomfort. If you already have a lung condition, like asthma or COPD, bronchitis can make each breath feel like a struggle, and can even lead to lasting damage if not managed properly. Ear and sinus infections are another set of complications that often follow the flu, particularly in young children whose immune systems are still developing. Bacterial infections can take hold in the sinuses or middle ear, causing pain, swelling, and sometimes hearing loss if not treated promptly. In severe cases, the flu can trigger sepsis, a potentially life-threatening response where the body's own defenses go into overdrive, causing widespread inflammation and shutting down vital organs. Sepsis is a medical emergency requiring immediate care to prevent catastrophic outcomes. For those already living with chronic diseases, the flu can tip the balance, sending underlying conditions into dangerous territory. Heart failure can flare up, diabetes can become unstable with wild swings in blood sugar, and chronic lung diseases can worsen dramatically. It's not uncommon for patients with these conditions to end up in the hospital once the flu has pushed their illnesses out of control. Though rare, the flu can also inflame the heart muscle, a condition known as myocarditis, or even the brain, resulting in encephalitis. These complications can cause irregular heart rhythms, confusion, severe headaches, or even seizures, and they require urgent medical attention. So, who is at highest risk? Seniors aged 65 and over are especially vulnerable, as their immune systems are less robust. Children under the age of 5, particularly infants, are also at higher risk because their bodies haven't yet built up strong defenses. Pregnant women face unique risks, as the flu can lead to serious complications for both mother and baby. People living with chronic conditions like heart, lung, or kidney disease are more likely to develop severe symptoms, and those with weakened immune systems, such as cancer patients or organ transplant recipients, are at risk for rapid deterioration. With so many possible complications, how can you tell when the flu has crossed the line from merely miserable to dangerous? There are certain red flags you should never ignore. If you or someone you care for develops trouble breathing or persistent chest pain, it might signal pneumonia or another serious complication. Extreme weakness, confusion, or inability to wake up fully are signs that the infection could be spreading beyond the lungs. A high fever that refuses to come down, bluish lips or face, and signs of dehydration, such as very little urination or feeling dizzy upon standing, are all warning signs that demand immediate medical attention. Now, let's talk about prevention and treatment, because a little preparation can make a world of difference. The single best way to protect yourself is to get an annual flu vaccine. Even if you do catch the flu after being vaccinated, your symptoms are likely to be far less severe, and your risk of complications drops significantly. If you do get sick, it's critical to start antiviral medication, like oseltamivir, within 48 hours of symptom onset, but only if prescribed by your doctor. These medications can shorten the course of the illness and reduce the risk of severe complications. In addition, support your recovery with plenty of rest, drink lots of fluids, and use fever-reducing medications as advised. If your symptoms worsen, or you spot any of the warning signs we discussed, don't hesitate. Seek medical attention right away. Why does all of this matter? Because the flu isn't simply an inconvenience you can brush aside. For the vulnerable among us, it can become a life-threatening crisis in just a matter of days. Preventive care, timely diagnosis, and proper vaccination are the keys to keeping yourself and your loved ones safe. So the next time you feel those familiar chills and aches creeping in, don't take any chances. Listen to your body, share what you've learned with someone who might think the flu is no big deal, and make sure you're prepared to act if it strikes. Stay informed, stay protected, and most importantly, stay healthy. By taking the flu seriously, you're not just protecting yourself, you're helping to safeguard your family, your community, and everyone who counts on you.